Okay guys, so here's an app I found and it's good for nursing and clinicals. It's called Medscape here. It's also good for you after clinicals. I just found it and it actually has a lot of stuff on there when you go into your career as well. So you open it up and at the bottom here you see the home page and it has news, surveys, which is pretty cool. You can pop over to news, see what's going on all in healthcare. Education. You can even get CEs, which are really helpful when you're trying to keep certifications, and even events, which is pretty cool. Online events, talking about COVID here, all sorts of stuff. But what I think would be really helpful for students initially is whenever you go into clinicals, you're giving meds, and most clinical instructors want you to tell them what the med's for. You want to know what you're giving the med for, side effects. So you can pop into drugs right here. And for instance, I already have some I looked up here. Something we use commonly in orthopedics is Eliquis. You can go there, see what class it is. It's an anticoagulant, dosages and indications. So what's Eliquis for? You commonly give those dosages, and it's to prevent stroke and embolism. And what's cool is it even tells you the duration for hip replacement, the duration for knee replacement. If you go back, it also commonly what we want to know is adverse effects. So what's a big adverse effect in Eliquis? Bleeding, and it even tells you where it commonly happens, which is very cool. So that's it for meds. Procedures. In orthopedics, we do a lot of different procedures, and it can be confusing and overwhelming to really understand what it's for. I'm going to click here on brain and spinal cord, and something we do a lot is laminoplasty. You can go into overview. It tells you about it right here, the background. It gives you a table on different kinds. If you go back, it even tells you the care that you would need, patient preparation, the anesthesia, the positioning, which is all very helpful. Another thing I liked in this app is, if you go back, conditions. So something that, can happen to a patient commonly is atrial fibrillation. So you go into cardiology, it's an arrhythmia, right here, atrial fibrillation. You click overview, and it tells you what atrial fibrillation is. It gives you an EKG strip to see what it looks like. It even has a video here, and that can show you if it will load. All right, so it's not going to load right now because I have my phone in airplane mode so that I can do this tutorial. But signs and symptoms of patients with CHF and what to look out for. So that's going to be very handy when you're on your clinical rotation and you have a patient with a certain diagnosis and you want to learn more about what it is because you're seeing it in person. So you can pull it up right here. Let's go back. Another thing that I think is going to be very important right here is the interaction checker. These other two things, decision point is more for when you're trying to make decisions about what kind of illness they have, which we're not going to get into that yet, especially when you're a new nurse. Calculators can be helpful about medications, but that's also a little deep as well. So interaction checker. And so I did this earlier. I know that vancomycin and Zosyn have interactions, so I put those two in. Can do it again. Let's see. So we're going to clear all. And you just add the plus sign, vancomycin and Zosyn, and view interactions found, this red button right here. Boom. Piperacillin increases toxicity of vancomycin. So you wouldn't want to give those two together. So we'll go back here. That's going to be really helpful. I even still use that to this day. We have some things at work, or you call and bother the pharmacist, but to have it on hand is really helpful. And lastly, I think something that I can use as an instructor, or even if students wanted to use it on their own and just play around, is top button cases and quizzes, which is very cool. The only thing I wish it had was organization based on body system or type of disease. Let's take this off airplane mode so I can actually show you. Come on. Here. So You have patient simulations, which you can choose one. A 25-year-old student with sleepiness and weight gain. And you read the whole study, and then it tells you who it's by, which is great. It's accredited. Their illness, and then you click through these next buttons and you watch videos. It's really like a true simulation in class. They even have, keep going, case challenges that you can go through about their symptoms and try to figure out what's going on, and Fast 5 quizzes. So I think if you have time, if you're commuting or something, and you want to just challenge your brain, those are really cool to have. So that's it for this app. Again, I like it because it's free. A lot of these other apps expire and you have to pay for, and who wants to pay for anything when they're in nursing school? So this is something that I think I would use with a future clinical group, and any nursing students out there, definitely take a look.